In the fourth section now, we will start with the malignant tumors of the external nose. And the three most common malignant tumors of the external nose, which we will talk about in this section, are basal cell carcinoma, squamous cell carcinoma, and melanoma. First, the basal cell carcinoma. It's a rodent ulcer affecting males and females in the age group of 40 to 60 years. So also it's a disease of the late age, and it affects both the male and female. And malignant tumors is, they spread rapidly, they are fast growing, and they can spread, and they are sometimes before even the treatment begins, they are already metastasized to distant area. So it affects both the males and females in the age of 40 to 60 years. Here, if you see in this diagram, this is the basal cell carcinoma, and the size, location, and depth of the tumor are the three main features that predict what type of treatment is required, depending on size, location, and depth of the tumor. Again, as with any tumor, surgery, then irradiation and excision is recommended for this. So cryosurgery is the surgery done by the cold, in which the cold is used to remove the tumor or the growth and to regress it. And then radiation therapy or surgical excision of the tumor is done, again depending on the depth and the size of the tumor. If it's not too deep and it can be excised completely, then surgery can be performed, and even to minimize the size, sometimes surgery and irradiation can be performed. So here, this is the basal cell carcinoma. The edges, if you see, they are turned inside, and it's this view. Presentation can be as a cyst, papillopearly nodule, ulcer with rolled edges. So here, these are the rolled edges, and it can present a cyst. Cyst is a fluid-filled sac, so it is maybe a cyst with the fluid in it, or papillopearly nodule, looks like a pearl, and papules, wart-like appearance with pearl. So all these are the three types of presentations of the basal cell carcinoma. They arise from the cell which are present at the base, and it's known as the basal cell carcinoma. Next type is the squamous cell carcinoma. These are the infiltrating nodule or an ulcer with rolled out edges affecting side of the nose or columella. So this side of the nose is usually the affected here, side of the nose, or the columella is affected, and it is infiltrating nodule. So it infiltrates deep, and it is, or it can be as an ulcer. So infiltrating nodule, this is the nodule shaped structure, or it can present as a ulcer with the rolled edges. Affects again same age group as the basal cell carcinoma, 40 to 60 years of age. So all these tumors, if you notice, they are of more middle age or past middle age. They are not the tumors of the young or early age group. Treatment is radiotherapy, excision, surgical excision to remove the tumor or any plastic defects. If they are, they can be, plastic surgery is done to remove those defects. So this is the squamous cell carcinoma, which arises from the squamous cell. Then the last one is the melanoma. Melanoma is the tumor, as the name shows, is the tumor of the pigmented cells, which are the melanin producing cells, and superficially spreading or invasive type, nodular invasive type. So melanoma, very known, famous American senator John McCain. That's the picture of John McCain, and he has the melanoma, and he died of the cancer. So it's superficially spreading type. It can spread, and it can be nodular invasive type, which can spread deep and can metastasize to different parts of the body or different structures of the body. So all these are the malignant tumors. Malignant tumors are rapidly spreading, invasive, and can involve different parts of the body. So usually the treatment is depend on the size, shape, and the location. If the tumors are deep invading, usually the removal from top are not very helpful in the prognosis. So again, the prognosis of these tumors, as with any malignant tumor, depends on the how much is the spread and how far they are spread, so they can be cured or not. So that was all about the malignant tumors of the external nose. Thank you for watching sqadia.com.